everyone. I'm Farzan Karimi. Thank you for joining my presentation. Today, I'm going to talk about moral roots of vaccination behavior, which is a county-level analysis in the United States. Despite considerable amount of evidence that shows vaccines are safe and efficient, some people avoid them. And from a moral psychological perspective, it has been shown that vaccine hesitancy can be related to moral values. In this line of work, there are two gaps. First one is relying on self-reported measure of vaccination and not actual vaccination behavior. And second, ignoring regional variables and mere focusing on individual level of variables. One of these regional variables, we can say that health related accessibility variables, which can be different in each county. So here we examine whether differences in county level moral values can explain differences in COVID-19 vaccination rates across US counties. To operationalize morality, we focus on moral foundation theory, which reduces morality into 5 foundations, including care, fairness, loyalty, authority, and purity. Here, I'm gonna talk a little bit about our data and our method, and actually our variables. Our dependent variables is vaccination rate, which we collected these data from CDS website. We have vaccination data of around 300 counties. And for independent variable, we have county level moral values provided by the work of Hoover and colleagues. These authors use post-stratification method to estimate county level moral values. These data actually are based on data collected from Your Morals website. And then for our control variables, we have a proportion of residents over 65, and the rationale behind this is that these age group have access to vaccines much earlier than other age groups. And then we have COVID-19 vaccine coverage index, which represent structural barriers. And then we have political ideology. Actually, it's political behavior based on presidential voting election. Yeah. And I dive into our results. We ran 3 Bayesian actually better regression model. Here, our first model, we just put a percentage of people over 65 and CVAC index. In our second model, we add conservatism. And in our third model, we add all moral values to the model. And as you can see, there is a stepwise improvement of explained variance. And in our third model, we got a negative effect for purity and also positive significant effect for loyalty and fairness, which means that, for example, for purity, county level purity actually is associated with vaccination rate. So if you can look at our generated predicted actually maps here, on the left side, we have observed vaccination rate. These are real data. And we have 3 maps for each model. And among these models, model 3 is more similar to actual vaccination rate. For our discussion, we can say that, for example, for purity, since purity is related to the idea of avoiding disgusting and contaminated and also novel and unnatural things, people who think that vaccine is an unnatural and novel thing and make their body actually contaminated would avoid vaccines. And for loyalty, we can say that loyal people would see vaccination as a patriotic duty. So to protect their community, they would get vaccinated. And this work may have some potential policy insights. For example, future work may examine the role of moral framing as a communication tool to encourage vaccination. And for more information on results and discussion, you can always check our preprints on OSF website. And I would like to thank all of my co-authors, Nils, Mohammad, Jackson, Brendan, Jesse, and Morteza. Yeah, I'm so happy to get questions. Thank you.